Hello seniors and welcome to today's video. Some people develop a constant, uncomfortable burning sensation in their feet. This condition often develops gradually, typically starting at the bottom of the feet and slowly progressing to the top of the feet, ankles, legs, and even knees. It usually affects both sides of the body, but in some cases, it can occur on just one side. This burning sensation can be incredibly annoying and is often accompanied by other sensations, such as tingling, numbness, electrical shocks, pins and needles, or even an alternating feeling of burning and ice-cold pain. These symptoms can significantly impact daily life, making simple tasks like walking or sleeping challenging. Today, I'm going to dive deep into the causes of burning feet and explore the treatments we use to manage this condition. Whether you're experiencing these symptoms yourself or know someone who is, this video will provide valuable insights. So let's get started and talk about burning feet. Burning sensations in the feet are a type of pain, specifically neuropathic pain. Neuropathic pain occurs when there's a lesion or disease affecting the nerves that transmit pain signals to the brain. Unlike pain from a cut or bruise which originates from tissue damage, neuropathic pain stems from dysfunction in the nervous system itself. To understand this better, let's explore how nerves work. Nerves are long, intricate structures made up of neurons. Each neuron has a body, located near the spinal cord, and a long projection called an axon, which can extend great distances. For example, consider a neuron that innervates the bottom of your foot. Its cell body sits near the lower spine, but its axon stretches all the way to your foot, sometimes over 3 feet long, or about 1 meter. The axon relies on nutrients transported from the neuron's cell body to function properly. If something disrupts this nutrient supply or damages the axon, the nerve's ability to transmit signals is impaired, leading to symptoms like burning or tingling. Interestingly, the longest nerves in the body, like those reaching the feet, are often affected first when there's a problem. This is because their length makes them more vulnerable to damage. I have another video where I explain neuropathic pain in greater detail. Check the description for a link if you'd like to learn more. Let's now explore the most common causes of burning feet, starting with one of the leading culprits: alcoholic neuropathy. Excessive alcohol consumption can directly damage nerves, but it also impairs the absorption and metabolism of essential vitamins, particularly B vitamins, which are critical for nerve health. For example, someone who drinks heavily over years may develop burning feet due to vitamin B1 thiamine deficiency, which weakens nerve function. I have a separate video detailing how alcohol affects the nerves. Check it out for a deeper dive. Another major cause is diabetes, which is often linked to neuropathy. In fact, burning feet can sometimes be the first sign of diabetes. Diabetes causes high blood sugar levels, which over time damage nerves, starting with the longest ones that reach the feet. If diabetes isn't managed properly, these abnormal sensations can spread from the feet to the legs, knees, and even the hands. For instance, a patient might notice they can no longer feel the texture of their socks or the temperature of bath water. One diagnostic test we use is called two-point discrimination. Normally, if you touch the skin on a healthy hand with 2 pencil tips close together, the person can tell they're being touched in 2 distinct spots. In diabetic neuropathy, however, the person might perceive the 2 touches as one, indicating nerve damage. Chronic kidney disease is another significant cause. The kidneys filter waste and excess fluid from the blood. When they fail, often due to diabetes, high blood pressure, inflammation, like glomerulonephritis, recurrent infections or blockages, toxins build up in the body. These toxins can damage nerves, leading to burning sensations in the feet, as well as other symptoms like swelling or fatigue. For example, a patient with kidney disease might notice burning feet alongside difficulty urinating or persistent tiredness. Vitamin deficiencies, particularly vitamin B12 deficiency, can also trigger burning feet. Vitamin B12 is essential for nerve health, and low levels, often due to poor diet, malabsorption, or certain medications, can cause neuropathic symptoms. I've covered this in detail in another video about vitamin B12 and neuropathic pain, so be sure to check that out. Hypothyroidism, a condition where the thyroid gland produces insufficient hormones, can also lead to burning sensations. Thyroid hormones regulate metabolism, and their deficiency can affect nerve function, causing symptoms like burning or numbness. Again, I have a dedicated video on hypothyroidism for more information. HIV/AIDS is another cause, as the virus itself or its effects on the immune system can damage nerves, leading to burning feet, numbness, or abnormal sensation. For example, a patient might describe their feet feeling like they're on fire or unusually numb, which can be distressing. Certain medications, particularly those used in chemotherapy, can cause burning feet as a side effect. Drugs like paclitaxel or vincristine, commonly used to treat cancer, can damage peripheral nerves, leading to neuropathy. This is often temporary but can persist in some cases. Finally, when we can't pinpoint a specific cause, we call it idiopathic peripheral neuropathy. This diagnosis is frustrating for patients, as it means the burning feet occur without an identifiable trigger. However, it's still treatable, as we'll discuss shortly. For a comprehensive list of these causes, check the video description below, where you'll find a link to download a free handout. You can share this with your doctor to discuss potential causes specific to your situation. Before we dive into treatments, let me emphasize, this video is for educational purposes only, and is not a substitute for medical advice. If you're experiencing burning feet, please consult your doctor. In an emergency, go to the nearest emergency department or call an ambulance immediately. The primary approach to treating burning feet is to address the underlying cause. For example, if HIV is the cause, antiviral therapy can reduce nerve damage and alleviate symptoms. A patient on consistent treatment might notice their burning sensations decrease over time. For alcoholic neuropathy, quitting alcohol is critical. This can halt symptom progression and, in some cases, improve sensation. Supplementing with B vitamins, under medical supervision, can also help. If hypothyroidism is the culprit, thyroid hormone replacement therapy, such as daily levothyroxine, can restore normal nerve function over time. For diabetes, managing blood sugar through diet, exercise, and medications like insulin or metformin is essential to prevent further nerve damage. A patient who maintains stable blood sugar levels might see their symptoms stabilize or improve. In cases of vitamin B12 deficiency, injections or oral supplements can reverse symptoms if caught early. For kidney disease, treating the underlying conditions such as controlling blood pressure or managing diabetes can reduce toxin buildup and nerve damage. When the cause can't be identified or treated directly, we focus on managing symptoms with neuropathic pain medications. These include antidepressants, like amitriptyline or duloxetine, which modify how the brain perceives pain signals. For example, duloxetine might help a patient sleep better by reducing nighttime burning sensations. Anticonvulsants like gabapentin or pregabalin, which stabilize nerve activity. A patient might start with a low dose of gabapentin and gradually increase it to find relief. Opioids, though these are used cautiously due to risks of dependency. They're typically reserved for severe cases where other treatments fail. I have detailed videos on these medications. Check the links in the description for more information. Beyond medications, lifestyle changes are crucial. Regular exercise, such as walking or swimming, can improve blood sugar control, normalize blood pressure, and distract the mind from pain. For example, a patient who starts a daily 30-minute walk might notice reduced burning sensations over weeks. Other strategies include wearing comfortable, cushioned shoes, avoiding tight socks, and keeping feet moisturized to prevent skin irritation. Burning feet can be a challenging condition, but understanding its causes, ranging from diabetes and alcohol use to vitamin deficiencies and kidney disease, empowers you to seek the right treatment. By addressing the root cause and exploring symptom management options, many people find relief and improve their quality of life. If you or someone you know is dealing with burning feet, share this video to spread awareness. Don't forget to check the description for the free handout and links to my other videos on neuropathic pain, vitamin B12, hypothyroidism, and more. Subscribe to this channel for more health insights, and let me know in the comments if you have questions or topics you'd like me to cover. Thank you for watching, and I'll see you in the next video.